Um, so do you think we should get started, Laura? And we can at least get through the minutes and everything?
Yeah, that sounds great.
Okay. Okay, well, welcome everyone. It's nice to see you virtually, and I hope it is less wet and gloomy in the DC area than it is where I am. Or is it the same? Pretty much, I can see from Dan's face. Yes, okay, so I guess there's no sun anywhere right now, but anyway, thank you for making the time for the board meeting, and I guess we'll just jump right in. So I think the only thing we have to vote on is the minutes from the November meeting, which Laura included in our materials. So could I have a motion to approve those minutes?
Motion to approve.
Okay, Judy, thank you. Is there a second?
Second.
Okay, and any discussion or questions about the minutes? So we're going to need to do a roll call vote since this is an electronic meeting that's consistent with the Open Meetings Act. So I'm going to sort of go in the order that I see people. So Patrick, I'll start with you.
Yes.
Okay, thank you. Ahmad?
Yes.
Okay, Hadley? All right, thank you. Judy?
Yes.
Okay. Colette?
Yes.
Okay, Emily?
Yes.
Mara?
Yes.
And I think that's everyone I see right now. So any opposed? So with that, the minutes are approved. Thank you. So we will jump into our discussion of reopening, and you know, just I'm going to turn that over to Laura, but you know, this is just an enormous topic, as you all know, for all schools, phenomenally complicated from many, many different angles. And I think people also come at it from very different perspectives. And so we want to have a good open discussion. We, you know, there are really two reasons to do it. One is Laura and her team have spent a lot of time agonizing over these decisions, thinking through options, talking about it, analyzing data, getting information from parents and families about what their preferences are. And I think it's really important that the board understand the issues they're grappling with and the thought process that they're going through. And I think Laura is also very interested in hearing everyone's input. I would say at the end of the day, as with any significant decisions, we're really here to advise her, but I feel strongly that as the CEO and head of the team here, this is her call as to how eventually we want to approach this. So, so I just, you know, it could be that we don't all agree, and I do want to have an open discussion, but at the end of the day, it will be the call for Laura and the team. So with that, let me turn it over to you, Laura.
Thanks, Michaela. And I would say, there is no perfect decision, right? Like whatever decision we reach, it will be the wrong decision for some people. And that feels hard because I know that we can't make everyone happy in this moment because we are all grappling with such different criteria about what is right for us as individuals and like as parents. And so what I really want to do is make sure that we are grounding ourselves in our data about what our families are telling us, because we are responsible for delivering good results for our families. And we need to be thinking about what are they asking us for? How are we bringing professional judgment about what is possible and what is not? And how are we building a case if we believe that there is something more that we can offer that could better meet needs over time? But I want to just start by really grounding us in or data, which says that, you know, more than 60% of our families now are saying that they are unsure, unlikely, or very unlikely to have their child attend school in person this spring if we were to reopen schools. And that creates a complicated dynamic for us to think about, like, how can we continue to deliver good quality education for all of our families, and how are we laying the groundwork for over time to move towards more and more in-person learning, given that we believe the conditions over the next few months, the next 6 to 9 months in particular, will be, we all pray, dramatically different. So that's really the kind of the way in which we are thinking about this issue. Senior team, we've discussed this extensively, and we believe that the best path forward is our third option, which would be begin the process of reopening by launching small in-person programming like on Wednesday afternoons this spring. And then use that to get our safety and health protocols as good as we can make them, to get ready for a large in-person program for our summer school, and then as many students as possible in the fall. And in order to do that, we need to be convincing our staff and our families that we have the right plan in place to meet the needs, both from like a health and safety standpoint, but also from like social emotional wellness and academic catch-up for the fall. And so that is the work that we are also doing in parallel over the course of this spring. And that's the work that our campus teams are planning for how we will engage families and staff in that discussion. So that's our recommendation, and want to use this time to like answer questions and to hear your thoughts and advice as we navigate this.
I have a question about the vaccination of teachers. Are you finding that many of the teachers are willing or not willing to get vaccinated? Does that make a difference? I've heard that Children's is going to be offering it starting this week, next week, or whatever, to all charter schools and, you know, teachers. What's happening with that? And does that make a difference in terms of all of this?
I would say our staff are in different places about whether they are like ready and willing to take the vaccine or whether they have concerns about the vaccine. I would say that is, that's something to figure out, but I would say the first priority is just like being able to get access to the vaccine is still a concern. So we've been working closely with a number of people at the city and then also at the DC Alliance, which has been trying to kind of like gather input from across the charter community to get access to the vaccine. And right now, the only people who are eligible to get the vaccine are people who are working, who are in person and who are in person serving students. And so we have a number of staff members right now who are working in person because they open our school buildings to provide meals and materials. We can still not get them vaccinated because we are not serving students in person.
So I get, maybe I've heard the wrong information. I had heard the Children's Hospital was opening a clinics for all, initially it was all just DCPS teachers, but then it was now going to include charters as well. So, and that was supposed to open like almost immediately. I don't know, does anyone know more about it, or is that inaccurate?
Hadley?
Go ahead.
We can't hear you, Hadley.
So that's okay. Judy, you are right that they are providing vaccinations for the educators, both in DCPS and in the charter community. But the criteria right now is like they're phasing in, you know, who's first in line, and who's first in line right now is dependent on, you have to be working in person right now, and your school has to be serving students in person right now. Dan, Serge, I know you guys have also been in these conversations. Is there anything that you would add to that?
No, that's right. I would just, the children's distribution is specifically DCPS staff. One Medical is operating the charter school distribution. But in either case, what Laura said is true, is today, the folks who are eligible are only teachers who have students in person.
And I think Children's, Laura, I don't think you said this, that Children's is only planning to do this for a couple weeks with just DCPS, and then One Medical is doing the charter teacher vaccines, and they'll probably be a long-term partner of the city on vaccination.
And Maura, is there anything that you would add about kind of vaccine, the number of vaccines relative to like the degree of need?
I think you summarized it well. I mean, the demand just so far outpaces the supply. There's about 4,000 or 5,000 vaccinations a week right now that can go towards anyone who's a teacher, an essential worker, a police officer, and you know, there's 20,000 staff members just in schools that need to be vaccinated. And so the city, as Laura, you said so well, is just trying to manage this tension. And that's why it's going to go first to staff who are in person with kids virtually every day before it can go to other school and staff members.
So I guess the assumption is that like our children have to get vaccinated every year, and there's a host of vaccines that they have to have before they're entered. Do we know if children are being allowed back to school, I guess COVID-19 will not be a requirement, or do we know if we foresee the COVID-19 vaccine as a requirement going forward with DCPS for students, not teachers, but specifically for students? You know, just, is it going to be on that mandatory list for the ones that you have to have?
I think it's too early to say for sure because it hasn't been authorized for kids. I think it wouldn't be crazy to think it would be at some point, but I think just based on both the authorization and the rate of vaccination, I can't imagine that being something that would be a requirement for this coming fall. And it's not right now.
And we don't think that the city will mandate it for teachers. Is that probably a correct assumption also?
That would be my assumption, but others who are more plugged into policy could weigh in. I will add that, to Laura's point about what our vaccinations, both for staff and for families, was relatively low on the list of factors that families said were driving their decision about whether or not they wanted to return in person. Now, that may be different for our staff, but from a family perspective, generally what we heard is that there were things that were more important to them than the vaccination availability.
Yeah, Dan, I was going to ask that question. What are the main drivers behind the families not wanting to go back? Or Laura, or whoever can answer that question.
I think it's a host of things. I would say for some, it is concern about the way in which COVID-19 is could impact their family. If their child gets sick, and gets other members of the household sick, that is a concern. Others are concerned about, I think that's the primary thing that we hear from families, is just like fear of how of the risk of the health risks that it poses to their family. But others on the team should weigh in, and we have Patrick, Nicole, if you have things that you would add for families that you are in contact with, would encourage you to also share that.
I just think it's for families that I've heard from, it's really just the numbers currently. And so they just don't feel like it's safe to return at this point. That's just, and that's not everyone, but that's some of the feedback I've heard. And
That's the feedback. Do the families have access through DC Prep to information about how schools that have opened both in the fall and even before have done, and how low the transmission rates have been at school? Or is it just simply they're seeing what they see on the news and they presume that it's very dangerous? Because I think schools, you know, and young children, the effect is much less than it is in the overall population, including transmittal back at home. It's just something that may inform them a little bit more and may potentially change some of their minds. I think option 3 seems reasonable because you guys are getting the kids back in school who either want to be there or and have, you know, small groups of it. But my concern is that the information's not perfect, and it's kind of just, you know, the headlines we're seeing on the news. But if you actually break it down a little bit and understand that school is not a big place where it's transmitted, and I really do worry for these kids not being in school.
I mean, my personal opinion was option 1. Now I'm a data point of 1, right? And for me, my calculus was, you know, you get to go back in the summer, so you start having those touch points, but also and I know that the other options would start essentially almost 9 weeks from now, so we would be talking about Mayish time frame, right? So I go, the longer we go before we start, I think the safer it becomes. And for me, when I say safer, because I think the infections rates will continue to go down as more people follow rules and guidance, but at the same time, more people in society are going to be getting vaccinated, right? So you're going to have more people that are getting vaccinated over this period of time. You're also going to, I think more people are adhering to, you know, taking those precautions. So I think the combination of those two things will drive down the likelihood that people will get it and that it will spread. So for me, I liked option 1 because I go, well, you still do some touch points, but it still draws it out a little bit more. So it allows me to it allows those numbers to continue to fall down. So like safety is very important to me, and I trust me, I get it with, I mean, my kids want to go back to school. You know, my 8-year-old was just telling me school's not fun at home. I want to go back to school, you know. This is just not fun anymore, right? So I'm like, yeah, you know, I get it. But at the same time, and when you talk about parents, you have to think that, you know, a lot of our students either live with their grandparents or they socialize with their grandparents right after school. So, you know, you talk about, you know, that child going there, despite the fact that it's a small possibility, they could still get it, then they take it home and they give it to a grandparent, and the grandparent could potentially get into some serious trouble. So for me, it was more, you know, the delay, like I said, the longer it is, I think we get a lot safer, the less likely that we'll have some transmission. I also thought that another big piece is just the safety at the school and what are additional health precautions that we're going to take, and whatever that detailed plan is going to be important to relate to parents. So I think Laura and I were talking about this yesterday on another call, and it was interesting. And I was watching the local news tonight, and Farabee was on there, and he was talking about how they're going to have these filters in the classroom, right? Like, and I got air purifiers in every room in my house, right? So, because I'm the panicky one, but you know, of course, there are HVAC systems that are out there now where, you know, I could, you know, people are trying to sell you things that cost a couple of $1,000s that, you know, this is the top of the line plasma system that kills everything. So I just think from a parent standpoint, like, you want to know that the school is doing everything that they can to keep their child safe, first and foremost. And then, so that's why, you know, personally, those were my reasons when I looked at the 3 options. I preferred option 1 because safety was a little bit more of a high priority for me than getting the kids back with those touch points. And I thought that by even doing something in the summer, you start hitting those touch points again and start making up a lot of what has been missed from the classroom environment and stuff. So.
Yeah, and I think. Oh, go ahead.
Sorry, it's Hadley. I'm having the worst technology day, and I apologize. I just have 2 questions. One, when you were sort of putting forth your case in the fall for reopening, you got a lot of pushback from the teachers. Do you think that with option 1, 2, or 3 that you have them behind you, or are you convincing both the families and the teachers? Is one question. And the second one is, do we have a sense of how far behind the students have fallen in this particular year and since last spring?
Yeah, so both great questions. There is a lot of work to do to help staff understand, like, you know, how will we handle the like inevitable, what are all of the things that we need to do differently when we come back in person, right? Because whether that is, you know, in May, whether that is in July, whether that is in August, we are all going to need to behave in different ways. And teachers want to understand like what all that will look like. We have some teachers who I think would be willing to come now and support with the option 3. I think we have fewer who would be willing to come for option 2. And we would have some teachers who were annoyed with us if we went with option 1, right? There's no answer where people are going to say like, right on DC Prep, you got this one, right? Because we're all different, right? And so we view risks differently, and we think about what is most risky to our students and to us in different ways. And so I am like making peace with the fact that like not everybody is going to love our answer, but we need to figure out how we do the most good for the most members of our community. And so that's why I think with option 3, we're trying to create a scenario where families don't have to experience significant interruption, right? Because like with 3, we can basically keep our virtual program intact. And so if you don't want your child to come in person, like they don't have to, and you're still going to be able to have access to the same teachers, the same kind of like depth of programming that you have today. And I think for many of our families, they say, look, you know, I may want my child to like come in person eventually, but like I'm happy enough with the way that it is, since I know that, you know, they're getting what they're getting now and they're safe. We have other families who are saying, my child needs something different. And so 3 is an attempt to try to give families more of what they need, at least in small amounts. So Hadley.
Okay, one last question. I'm sorry.
Yeah. No, you're fine.
What if COVID doesn't go away? And I don't think it is. Is there a time at which we're all going to just have to live with this. Because when I keep reading about the variants and all this stuff, and I've read a lot of studies, and Duke did a really interesting one where there was actually in 90,000 people, students last fall, not one case of transmission from child to adult within a school setting. I think it was Ahmad who said, like, have we looked at the places? Because I feel that our students are being penalized for living in Washington because a lot of the country is back at school. Like, is there a point at which people are going to throw up their hands and just go back to school? Or because I think this will be with us for a very long time.
I think you're right to say that we need to be realistic that this is.
Yeah, can we sustain this? Can you sustain the virtual and in-person for the next couple of years?
I think the answer is no. Like, I don't think we can. But I also think that the work that we need to be doing over the next 6 months is saying, okay, if we believe that the best way for us to be able to educate children is in person, then we need to like do the work of trying to say, here are all of the ways in which our in-person program is going to be safe, right? Like, so I think we're relying on one, the things that Patrick was saying, right? Like with vaccinations, with like, you know, people, hopefully if there's like a national plan for like, these are the things that we need to do, there can be more alignment around like people taking the right steps to keep all of us safe. And then if we ramp up vaccinations, that should help. I don't think that COVID will go away, but I'm hopeful that we will get to the point where transmission levels are like at more manageable levels. In parallel, I think what we need to be doing is we need to be working more closely with community organizations that are experts in this area. And so we just had, Serge, can you just look up the name of the group that Danielle attended today? I have there's a group that is specifically working within Ward 7 and 8 in order to like get more families more access to information about like the vaccine, for example, because I think there's lots of places where different people have questions and concerns that they don't always feel like they have answers to. And I think the more that we are doing the work of helping families see like what are the, you know, these are the safety measures that help keep kids safe within school. Come and walk through our school buildings. Let's show you what it would be like. I think those are some of the comments that I saw in our survey that I felt like we would actually be able to address if we were moving on a timeline that allowed us to like slow down and invest in families to say, you know, you have questions about like what drop off is going to look like. And if we're just going to like take your kid's temperature and then everything will be fine, right? Like that's, you know, families are saying like, that's not enough. And we agree that that's not enough, but we need to actually like let families ask more questions and I think engage with them in a different way to then build their confidence that this can happen safely. I also think the more that we're like actually operating in person and saying like, we're having kids come into the building, like it's going well, right? Like this is what happens with, you know, if there is a case, this is how we handle it. You're going to know about it. We're not going to sweep it under the rug, right? Those are the types of things that I think will build confidence to hopefully get us to the point where in the fall, we have many more kids in person. And I think we also need to do the work we have to do work first for ourselves to say, how are we going to handle it in the fall if we're able to get, you know, 90% of our students in person? Like, what are we going to do about the 10% of kids whose families want them to remain virtual? And like, can we realistically continue to provide the same quality of virtual learning experience, you know, and how can we make sure that we're upfront with families if we can't, so that way they're also making the decisions for themselves about what the right environment is for their child.
Yeah.
I'm betting on the fact that we will be able to operate in person safely, And I'm acknowledging that like there may be some families throughout this who decide permanently that like they want their child to move into like virtual learning, right? I think that's not outside of the realm of possibility, but then like we're not the right school for them.
Right. So Laura, I don't think you can basically make your decisions based on that 10%. So in my estimation, like the way, and that's why option 3 seems to make sense, is you got to get kids back on campus. And I think once other parents, as you said, see it successfully work, that's going to be the most effective thing. Because you can send them, you know, I'm glad Hadley brought up that point about the Duke study, and that does make sense. The transmission doesn't happen. But unless you rip the Band-Aid off and get kids back in there, I think there's always going to be excuses. I mean, look, this is not going to be perfect. COVID's not going to go away. So you're going to have people just keep saying, well, there's one variant and I'm worried about that. Well, if that's going to be the perspective, then you guys are never going to open up again. And that can't happen. So it sounds harsh, but the reality is you got to get some kids back. It sounds like option 3 makes sense. I would even go more aggressively. I would let all the kids come back whose parents want to let them come back, but
There's
something has to happen.
Because, there's no way to actually do that. So one of the things that's really tricky about the way in which our staffing model works is like we can't open schools for 30% of our students without like decimating our virtual learning program. And so that doesn't feel like the right answer given where the bulk of our families are at this moment in time. Because I have an obligation to like meet the needs of as many of our families as I can. And if I take, 30% of my staff away, then my virtual learning program like falls apart.
So Laura, can I just throw out one question?
Yep.
So 2 parts to this. One, you said it's 70% you think that would stay home?
That's our best guess. Like, I think.
What's the most, when did you most recently survey parents?
It closed on like over the weekend.
Okay. And so the data based on what's come back so far is about 70% would stay home? Yes.
Yeah, 35% of our families say they are likely or very likely to send their children in person if, and the caveat was, assuming community transmission levels are at or below where they were in the early fall and vaccine rollout for adults is well underway. So I think
I guess my question to you, sorry to interrupt, is if you knew this was going to be the new normal, how would you change your staffing model to allow 30% or whatever it is to come back and not totally mess up learning for the kids at home? Like if you had to, and I only bring this up because, at GDS, when we had the same situation, the staffing model didn't work there either, the way it was done. And so we actually had to literally completely change the entire staffing model to allow some subset to come back and everyone else to be home. And so I'm curious, not that you did this immediately, but if you thought this was going to be the next year, you might say, I'm going to literally reinvent staffing. Like, how might you do that? And if you don't know right now, is that something that you feel like you and the team would want to figure out to have that as an option, over the next month to put together?
Yeah, it's a super smart question. And I think we definitely need to rethink how we are staffing, because I think we're going to have to redesign our virtual program for the fall, I anticipate, because of this issue, and or because, more of our families want to be in person, but there's still kind of a group of families who want to be virtual. So I don't have an answer for you today, but it's a smart question and one that we are thinking about.
And my personal feeling is it is inevitable. We're going to have to do some form of both, at least for a while, hopefully not indefinitely into the future. But, and I just wanted to follow on with the point Hadley made earlier about, are our kids being penalized because they're in Washington? I think we're going to see, as DCPS opens up, assuming the union doesn't, prohibit them from doing that. But if they stay on the course they say they're on now, and they partially open, I think it will be a mixed, it could be of mixed quality, but that will be a bellwether for other teachers and for charters. And my guess is by late spring anyway, there will be a significant number of charters who at least have some of their kids back in person. And as Ahmad said earlier, I mean, I think as more families see others who are going in person, they will gradually get more comfortable. And that's one of the things that I find attractive about option 3. I would be concerned, I think, if we didn't do anything, you know, before summer or before early fall to get them back in person, because I think we would probably end up being an outlier. And I think that probably would not serve us well long term. The other thing about option 3 is that I think it's intentionally a strategy that allows us to learn. So it's very hard to experiment in anything in education because of just the way school is structured. But I think we'll build our own confidence as well as, you know, families, our staff's confidence and family confidence by starting small and seeing what we can do that really works. And I think we'll probably be in much better shape going into summer school in the fall.
Yeah, I agree. Can you guys remind me, I'm sorry, are there any DC Prep parents on this call right now?
Patrick and
Okay.
Nicole, I think, if Nicole's still
Great.
here.
So yeah, I'd like to hear, I heard Patrick's point of view and I appreciate that. And I understand being concerned. Nicole, what do you think?
I like option 3. I think it gives the school a chance to just get everything right, having a smaller set of students instead of everyone going in at once. And if, you know, we can come up with all type of plans, but we don't know until they're implemented if they're really working. So I kind of feel if everyone going back at once in the fall, it doesn't give a lot of room for error. So I like the idea of a small number of students returning first, and just get everything down. So when the fall comes, you know, the fall's here and the entire population is back, you know, you'll have your policies, your procedures and everything down at that point. And I agree with, you know, once it's normalized again that kids are going back to school, I think it will give confidence to other parents to send their children back as well. One thing that we just have to remember is the community that we're serving. You know, there's lots of things out there, you know, I don't want to say conspiracy theories or things of that nature, but, you know, there's just a lack of education in some regard. And so we can't forget that. And that's why a lot of parents are hesitant. They just don't have the education or the knowledge, or, you know, the data hasn't been presented maybe. It's kind of hard to change people's minds when it's made up about certain things, but, you know, it hasn't always, you know, our community is not always trusting in vaccinations and things of that nature. So that's just something, you know, I think we're forgetting. I think a lot of it is because of not trusting government, you know, not trusting medicine and things of that nature. So we can't forget that. I think that's a cause for a lot of people not wanting to send their children back.
Nicole, will you send your children back?
Yes, I would. And a lot of it, I'm in the medical field. I've already gotten vaccinated. You know what I mean?
Right.
So for me, it's a little bit different. Not everyone, you know, trusts the science like I do. But yeah, I would definitely send my kids back.
So this issue of trying to convince people to kind of listen to science and to kind of trust people, and, you know, if that's a big issue, is there any, between now and the fall, should we be doing any education? Are there people that people would listen to? I mean, influencers of sort that people would trust in the school community to come in and talk about, you know, we're not just sending kids back to school because it's been a long time. We're sending them back because we've learned ways for them to be safe. And, you know, other schools have done this, and, you know, the study that, you know, Hadley just mentioned, or whatever studies are there, or other schools in the city that have been successful because they've instituted certain things. So, you know, how could we, you know, help people understand? I don't know if you have any thoughts about who could talk to people, who could give them information, who would people trust, and, you know, how can we get them to trust that, we have approaches and ways to make it safe, not just because it's time and we're getting tired of it,
Yeah, that is, I think it's a great question. What we had someone who went to a meeting today. We were trying to get connected with the Leadership Council for Healthy Communities and the Black Coalition Against COVID-19. So those are both like two community groups where it's like medical professionals who are working with leaders in the faith community and with like health advocacy groups in Ward 7 and 8. Because what I think we have a role to play, but what I think we also need to do is make sure that we are like creating platforms and like amplifying the message of the people who like do this work, like, like this is their work of like getting like the right medical information to, Ward 7 and 8 in particular. And so we're trying to understand like how we can plug in and support those efforts. I'm sure that there's like other work that needs to happen as well. Maura, do you want to talk a little bit about the work that like the city is planning? Because this is a question that we've been asking to city leaders as well, because like, yes, we need to do work within our community because relationships matter, but also like there needs to also be like consistent message coming from like the city and like the national government to help people feel like DC Prep is not just like making stuff up on our own.
Yeah, DC Health is in charge of a public health communications campaign related to the vaccine. They have repeatedly said that they will have a school-focused component of that campaign, meaning they will think about who the right validators are for staff as they're making their decisions about vaccinations. And eventually when vaccine is available for kids, they'll be thinking about how families would make that decision for their own children and who might be important messengers on that. I think the problem is that DC Health has 1,000 things they're trying to do. It's not just schools, and this is really not their priority right now. So there haven't been any details about when that campaign would happen, how much it would be, how much of their public health messaging will focus on school communities. In the meantime, OSCE is trying to step into the breach. And Laura, this is actually late breaking news. Shauna called me at 5 to say that they want to move ahead with kind of a relatively light touch way to support LEAs. But basically they want to create a speakers bureau of groups like the Black Coalition Against COVID-19 and public health experts. Lee Beers, who's the head of the American Association of Pediatrics, has offered to help to get those kinds of speakers essentially sourced and then made available to schools and childcare providers so that you could do targeted webinars for your school community. And then there would be kind of a toolkit for LEA leaders on talking to your staff about vaccination that would complement what DC Health has already put out for a more general audience. So they're hoping to stand that up in the next few weeks, and they've asked us to fund that, which I think we'll be able to do. What I talked to Shauna about, Shauna's the interim state superintendent, for those of you who don't know her, was what else LEA leaders might need, because I think you're hearing it in this conversation that the Speakers Bureau is a helpful thing. I don't think it's enough for the magnitude of this need, but I think it is a helpful step in just getting messengers out who are trusted by school staff in making these decisions.
I have one question. Sorry, it's Hadley again. From the way I read the mayor's orders, you can't have more than 12 unless there are 2 teachers. You can then have 13 people in a classroom. Does that still stand? And if that's the case, I do think it's a real stumbling block for everybody, considering our class sizes are higher. And I would argue that the mayor's just opened up indoor dining at 25% without masks and church at 50%. So is there any way we can get that changed?
I talked to the mayor's office a bit about that, so I'm happy to answer this one, but Laura, you should jump in. They've been pretty clear that DC Health is not going to change that guidance anytime soon. And the DC Health has already changed it once upward after a lot of pressure from DCPS. I think it might change as health conditions change, but given that where the cases are now, I don't think DC Health sees a reason to do it. And I don't think the Deputy Mayor for Education's office or DCPS or others would feel comfortable pressuring them on that. So I think it's going to be a while before that changes, if at all. That seems to be kind of a hard and fast number right now.
But isn't it strange that we can't have 20 kids in a classroom, but we can have 50 people in a restaurant? I mean, if we're talking about health.
Yes, but I think, you know, there's just broader forces at work in terms of how the mayor's making decisions about small businesses versus schools. And I think that's what it is.
Gotcha. Okay, thank you. Sorry.
I was just going to say, I think probably the most important thing for parents is like the safety protocols, right? So I think when we talk about whatever this robust communication plan is going to be, I just think it has to be rooted in the data and the science and also the protocols. So like as a parent, I want to know that, you know, my child coming to school is going to be safe. I want to know that that the protocols that you're following and that you've put in place are based in science and fact, right? Because then it leads credence to the to what you're saying. And I know the communication plan to get that out is, you know, I know that there just needs to be a lot of thought in that and how we go about doing that to make sure that it resonates with the intended audience, right? And like, what's the best way to do that? You know, I've got like my best friend flies for Delta, right? So he gets tested every week. You know, so Delta's protocol is that you get tested every week, right? So he gets tested every week, and he goes, Patrick, you know, the airplane is the safest place in America. He goes, we scrub these planes like so much, they clean them, you know, after every flight. And, you know, he's telling me the chemicals they're using and all of that stuff and the filters that they have on the aircraft. And, you know, so, you know, their protocol is we clean the aircraft after every flight. Here are the chemicals that we're using. We test our pilots weekly. You know, if they test positive, then they're down for 10 days. You know, I mean, you know, so what are those protocols and things? So it makes you feel safe if you're going to go get on Delta's airline because they have these protocols that are in place that they're following and stuff. You wear a mask, you know, and like for Delta, they still leave the center seat open, you know. And, you know, how do you take that dynamic or those protocols and go, these are the protocols that we're going to have in our classrooms. Here are the protocols we're going to have in the schools. And hey, it's rooted in fact. You know, if we're going to sit the kids 6 feet or 8 feet apart, you know, we're doing this because, you know, CDC guidance says that, oh, by the way, here are all of these studies that kids have been going to school for, you know, several months now, and the transmission rate is low, you know, and everything. So those are just some more of my thoughts.
I agree with you wholeheartedly, right? That like people just need to like touch and feel like the policies. I think where we have been wrestling is figuring out, like we've shared, you know, we did a lot of work, like, you know, particularly over the summer and then kind of again in the fall to like build these policies. We had them vetted externally twice by like, you know, people with, you know, medical like science backgrounds. And we're still not totally getting through to our staff. And so I think it highlights an opportunity for us to think differently about how are we engaging our staff to really feel like they understand like all of those protocols, to your point. And I think having the best ambassadors, I mean, like Nicole, you and I had a conversation at one point, right? We were talking about like the importance of like, you know, parents don't know me, right? They know their teacher, right? And they know the teacher who like, you know, 2 of their children have had now, right? Like there's people that they trust. And so we need to figure out how we are also like doing a better job of getting our staff ready to be ambassadors for us, because they are the ones who I think are ultimately going to be the most compelling to our families. Serge, Niels, Dan, would you guys add anything to that?
Laura, real quick, I'm looking at option 3 again. How many people do you expect to be in how many students do you expect to be in person in these small groups?
I have no idea. I would love to be able to venture a guess. I have no idea. We have been talking, we met with our principals and our ops managers earlier today. I think so much of it is going to depend on the enthusiasm with which they endorse the plan. I think will be part of it. I also think part of it will be a question of what happens over the next 2 months, right? Because if it is the case that, any teacher who wants to go and get vaccinated is able to go and get vaccinated, they may feel very differently than if they still feel like, nobody can get vaccinated, right? I think that there's just things that there are things that are within our control and there are things that are outside of our control. And the combination of the two mean I don't feel like I have a great sense of how many teachers will opt in. I can say I feel what I told our principals and our ops managers is if we are doing 3, we are doing it and we are going to work our tails off to figure out how we get, teachers to say that they're willing to do this. And then I think the question will be for families, 1, do they believe that it's safe? 2, do they believe that it's convenient? 3, do they believe that the bringing their child in for whatever it is that's offered to their child is worth it?
Yeah.
They're all still questions.
Right.
Others on the DC Prep team, if you have additional thoughts, would encourage you to share.
Just real quick, I would say very high level. I think Patrick made a great point about, the families and maybe the teachers understanding the risk. Everyone was scared of flying at the beginning of COVID. Then information came out that the chances of you getting COVID on a plane was 1 in 7,400 if you're wearing a mask. So that information is essential. So, Hadley made a point about this one study. If that information can get out, Laura, on a very high level to say, look, the transmission rate at schools is 0.2%, whatever that number is. Okay. And then contact, if you can, the families and the teachers that are willing to go back, like Nicole or the other families, and get a real idea of who's willing to come. Because once the momentum starts, I think more families will come back. And I do think it's important to do this if you can in the spring, because if you wait till fall, then there's going to be excuses then as well. And I say it respectfully, I do think the momentum needs to start now. Maybe I'm being overly optimistic. I think things are going to get better. We have families on here. My kids have been at school, not as much as I wanted to, but they've been at school and it's been safe. And, I know I have friends in Florida that send their kids to public school there. Their kids have been in school the whole time and it's been safe. So I think this is important to get those points and to get, kids back even in small groups, because then it will get bigger. So that's the last time I'll say it. That's my point.
Anybody else who has not weighed in on this yet, who would like to make a comment or observation or has a question?
I just think that we have to remember and just be mindful about getting students that will be in person. We just have to remember staffing as well. Suppose there's more students who are willing to go in, but the staff are not comfortable going in. Are you going to now penalize them for not going in? Are you going to tell them that they don't have a choice? So those are just things that I'm thinking of that would be a barrier for us to, go ahead and go full-fledged. You know what I mean? You have to have the support of the staff, because if you don't have the support of the staff, it's not going to be successful. So I just think that maybe the first step needs to get the staff all on the same page. You know what I mean? I think that has to be the first step, because if the staffing's not in place, it just can't be done.
I'll just say, Laura, I'm sure you're doing this, but since lots and lots of people have figured out both how to staff it, how to do it, I would just sort of encourage us, make sure there's, someone is doing analysis, or maybe it's Maura, you already have it, of all the ways to manage this. And I think one of the things that I wonder out of this is there a fundraising opportunity around proctors, right? And sort of people who are getting tested, who come in so that the staff is primarily virtual. Both if you end up in a situation where more families want to come back than teachers, and so that you have teachers who can teach across cohorts or groups, might there be a way to get a grant for a year of extra sort of staff that aren't the teachers, but are there to sort of monitor and be in the rooms, if that makes sense? So just throwing that out. I don't know if you've already looked into that.
Yeah, it's a great question. I would say, as we think about like our planning for next year, we should certainly be thinking about the extent to which we're able to like figure out like, a bridge solution that would involve different staffing configurations. I think the question for us always is, who we put in front of our kids is so important. And so we're always thinking hard about, like, when do we need to hire them to be able to train them to then, supervise them? Like, so it's just like, it's a cascade. And so I think it's a particularly relevant as we think ahead, and more challenging kind of in like the immediate term.
The more I hear you speak, Laura, it sounds like an interesting idea to use proctors and other things, and certainly something really worth exploring. But I don't know if I'd feel comfortable sending my child to school if the teacher didn't feel comfortable. So I do think even with all the science base, I mean, you have to get the teachers on board. And is there any way that they could be talked to, who could talk to them that would make them feel comfortable with it? Because if the teachers don't feel comfortable, I don't think you have a chance of any families feeling comfortable. And so how can we educate the teachers that they'll be safe? And, even though it's been a long time since they've been in the classroom, there are other schools and there's other teachers that they could even talk to who maybe were scared at first, but now months later, they're really doing fine with it.
Yeah, I think you're you and Nicole, I think, are making exactly the point that we agree with, right? Which is like, we need our staff to say yes, right? Not because we are forcing them, but because they believe it's like the right thing to do, that it's the right thing for kids, it's the right thing for them. And so what we're working on, what we've already said is like, we're not going to force you back into classrooms this year, right? And so we have to convince them that it is a decision that they want to make for themselves, because I just can't see it being good for us as an organization. Like, that's not the way to like lead people, right? Is to like,
I just want to push back for a minute, which is to say, I hear you, and I know it's not something that naturally feels comfortable, but people are doing it all over the country. And I think there is something different about sometimes health risks for teachers than for some students. And more, I think of it as an equity issue, which is there's childcare involved, right? And for some families, the not having the option to send their kids someplace is a huge burden as people start opening up work again. And I think right now it's been more okay because, it's been, unless you're a frontline worker, a lot of people have been able to stay home. I think as the vaccine rolls out, there could be a world in which people are forced to go back to work and have no options for their kids. And then it starts to feel like, to me, more important to create an option, even if it's suboptimal, that people don't have to pick, that if you can't get teachers there, you have a plan B to create it. I just think there's an equity issue here that is beyond sort of, it may not be optimal, but to just sort of wait for the teachers may not be optimal.
I hear you. And I think our basic message has been, one, this year, we don't believe that like forcing people back in person is the right answer. We also believe that like we as an organization are most effective in person, and we believe that the conditions will be right to be able to do that over the summer and into the fall. And so we're trying to set the expectation now that we will be in person in the fall. we are trying to like start slowly, pilot
Yep.
things to like the point that I think it was Nicole was making earlier about like building the muscle to like get really good at the health and safety protocols this spring, and trying to start with the people who are like willing to do it, to then be able to demonstrate that like this can happen safely. We're going to do right by people. And in the fall, this is who we are. So this is what we're going to do. And like, we need to be ready to do that. So I think it's, I don't disagree with you, Jenny. I think it's just a question of like point in time, because right now, if I said, you know, we are going to be back in person right now, I don't think I have like the family demand to be able to make that case in a way that will resonate with our staff, particularly because like we have so many parents who are still saying like, I want my child to be virtual, or like, I don't know yet whether or not I want to be in person.
I hear you. I hear you. I'm really talking about sort of late spring, which is when I think it gets more complicated for families who have to be in work. But I hear you.
I was just going to add, I put something in the chat just in preparation for this, because I was trying to think about data, you know, are there hard points? And just to kind of see where DC was, but it was the COVID CDC, and I put Maryland, Virginia, and DC in there, just like, because I was like, okay, if infections rates is a data point that, you know, we would want to consider, like, well, how are we doing in DC, and how are we compared to others, and states that are open and stuff like that. So, I mean, you can select different states on there. So, you know, I'm going to go back and add Florida. You can put up to 6 different states on there. It'd be interesting to see what their infections rate is. And if it's higher than what ours is and they're open, you know, there may be a good data point for consideration or something.
I do think it actually, I think DC has one of the lowest, and I mean, besides maybe Maine and Wyoming.
Mm-hmm.
We are still sort of hovering around 5. Maryland, I think, is at 11. I mean, all Georgia, Florida, they're all much higher. So if that helps, absolutely, that is the case.
I'm sensitive to I want to make sure this is an important conversation and we should spend as much time on it as we need to. I also just want to do a time check because it's 6:30 now, or 6, my clock is fast. It's 6:20 now. So I'm just going to ask Michaela, like what you want to do at this point.
No, that's fine. You beat me to it. I was just going to try to wrap this up. I think if anybody has a point they really want to make or another question they need to ask, please do it. But otherwise, we'll move on. And I think it's been a very good discussion, and thank you all for leaning in. It's good. Anybody else on this? Okay. Okay, then we'll move on to the AMC update. Dan and Niels.
Thanks, Michaela. I'll provide a quick voiceover because there's been some changes, some updates since we sent out the board notes. So I'll give a quick update and then open for comments or questions. So as you all know, we have a 2-year lease for AMC in a temporary space at the Bernie building, and we intend to move those kids into Wilkinson for a start in fall of 2022. We're working on a few different fronts to make that happen: financing for the construction, the design and management of that construction. Niels is working on community and public relations, and then securing a lease from the DC government. And obviously we need all 4 of those to go right for this to be a success. And right now I think we can say 3 are going well, or at least okay. And there's 1 of those that's presenting a bit of a roadblock. The ones that are going fine, financing is going fine. We've talked with a number of banks already. They all think this is financeable. They're not foreseeing problems with this. Management of the construction project is going fine. We have vendors on board. We have an owner's representative who's been working on our behalf, Jair Lynch. Community and public relations, Niels can correct as he sees fit, but it's also going fine. We continue to have some support. We don't have a strong visible opposition as we did at Frankfurt yet. The place where we've hit some roadblocks is our work with the DC government on securing a lease. we've been working with DGS, the Department of General Services, on this Wilkinson lease since last summer. And we've always known there'd be some hiccups, I guess we could say, some challenges, because, you know, we've heard from other schools and we've had experience with DGS's kind of slowness or bureaucracy. And that's what we've communicated to the board the last few times we've met, that DGS is working with us in good faith, but it's going slowly. As of the last week or so, we now feel like we're potentially facing a more significant roadblock from DGS. In short, they've changed position on what part of the standard district disposition regulations the mayor exempted us from with the Budget Support Act, and the timeline in which we'd be able to resolve that. It's not a new topic. We've been talking to them about this point since August, but the answers they've been giving us between August and now have now suddenly changed, which would put at risk our ability to open in fall of 22. It's hard for me to say that DGS isn't acting in good faith. I think it's more that they're seem critically enabled to actually execute on their plans in a way that's sort of having the same impact as if they weren't acting in good faith. So Laura's been engaging with Paul, with the deputy mayor, on this, and he, I think, has been pushing hard on our behalf. And so I still feel like we have some hope that this can be resolved and we'll be back on track. And, you know, in an ideal world, we're updating you all with good news sometime soon. But it also means we have to start planning more in earnest about what happens if we're not able to open on time in fall of 2022 at AMC. And start exploring a variety of options, which include pushing to stay at Bernie for an additional year, which I know Laura has talked to Paul about and is not off the table. Be simple because we need to take up more space in the building than we currently take up. And Excel is obviously using the rest of that building right now, the DCPS school. Another option would be sort of rejiggering our move into Wilkinson so that, you know, we're either moving in modular units to start or moving in before all the renovation happens, something that allows us to delay further our schedule, but still move in fall of 2022. Could also imagine us keeping some students at our V Street location, which does not have a ton of extra space, but we could convert some staff spaces into student spaces. Maybe we could fit one grade level there. Combining a few of these different options together, maybe some kids stay at Bernie, some kids stay at V Street, and that buys us an additional year to go through this process. Of course, we can look to other short-term lease options as well. None of these alternatives are good. And so obviously, by far, our hope and our first priority is to work with the deputy mayor and hopefully resolve this and continue back on our path. But I think it's at the point where we need to be more seriously considering some of those other alternatives as backup plans.
Dan, could you say a little bit more about what the specific new issue is with DGS? I'm still trying to understand, is this a timing issue or an issue of substance? It sounds like it's more of a substance issue now.
It's a, my understanding, and DGS, I think, tried to relate in generous-ish language, is not especially clear or coherent from meeting to meeting. So in some ways, it's a little difficult to really uncover what it is that their leadership team, and I think more importantly, the district's lawyers, I think, are what is driving this process right now. But from my best understanding is it is not so much a substantive issue in the sense that nobody's arguing that other schools could have access to Wilkinson or other organizations could have access to Wilkinson instead of DC Prep. It is really a timing issue and a question of whether we have to go through a process, the 10801 process, which has in the regulations some very prescribed timeframes. If we would have to, post public notice, wait 60 days, post some more notice, do this other thing. And given where we are right now in the timeline, we really have to have a letter of intent and a lease that's approved by council by by the time they go to recess this summer to be able to break ground this fall per our current plans.
Bottom line is very, very, very difficult to get business done with the District of Columbia. This is partially political and mostly just slow. Maura, you've seen more schools than we have. Do you have, how have others been able to accelerate the bureaucracy into doing something right for the kids? Do you have any,
yeah, I mean, this is a really unique situation. So I would say what other folks have done is figure out ways to operate in buildings before they have a lease. But that's usually because somebody has a master lease with the city. And so they're falling under a different lease, like Building Hope. And so there's more flexibility in those terms. We don't have that in this situation. So I think the conversations it sounds like Laura is already having make a lot of sense. The backup plans that Dan described make sense. Just that we maybe get some expertise from lawyers who know the city code really well, so that if there is room for, you know, multiple views on this issue of what the city exempted us from and what it didn't, we should just get some expert advice on that. But I'm not sure there's anything else we can be doing that we're not already doing.
I hope to be able to provide a better update on that question later this week, because I know that there was a meeting happening today with a cadre of city lawyers to discuss what constraints there are and whether there's ways to move forward as quickly as possible.
I assume that, Laura, your relationship with Paul, if he really wanted to get this done, or if he were to convince, I mean, and take 10-801 off the table for whatever that problem is, maybe he could, as Deputy Mayor for Education, get that done. Jair Lynch is a well-connected advisor. I would put a lot of pressure on him, Dan. I mean, this is owner's rep. This is what he's supposed to be able to do for us. I'd like to think he can help. You know, I think getting a great lawyer to say 10-801 doesn't count, it doesn't impact us. I mean, that's certainly one thing we can do. But you know, it's just so difficult to get anything done, you know, with the District of Columbia, and this is why charters make sense and DCPS doesn't. So I think working up, as you have outlined, alternative plans as well, Dan. But I wish you know, it's just incredible that it would take a couple of years to get a lease done. You know, it should be, you know, a private law firm could get that done in a couple of days, I would assume. So it's, you know, it's a mess. I wish I could, based on my experience in dealing with the district, I can't be overly optimistic, but good luck.
I'm hopeful that we will have more news later this week. We will surely update you as soon as we know more. And I think I was encouraged that, you know, the message that I heard from the Deputy Mayor's office was they know the quality of school that we are able to provide, and, like, you know, they view the building as being best used by having like a strong middle school. And so, you know, I heard the message that they were going to do what they could to try to, you know, move forward with a decision that, like, the mayor has like, you know, started to put into effect through the legislation that she passed. And so now I think we just need to hear what the outcome of the conversations were today. So.
And do you have a good attorney that might be able to help you, other than Jerry, and maybe Ahmad knows, can help you get I think we should be fighting on all fronts, and getting a good attorney in there to argue 10801 might be helpful.
Yeah, I was gonna ask around. I don't have someone in mind. So if anyone has experience with somebody.
Yeah, Dan, send me an email after this. We work a little, we do less development in the district now. Terry might laugh at this, but a couple of years ago, it just became so difficult. So I understand, your perspective, but there's a couple of guys we use at Goulston and Stores and some other places that could be helpful. Maybe they'll take this on.
Yeah. We had Wayne Quinn helping us for the first 10, 15 years. So Ahmad, that would be very helpful. I think Dan and you ought to get together.
Okay.
Somebody that knows the inside of these lawyers can mess it up big time. So thank you.
Okay, anything else on AMC? And let us know, Dan, if we can do anything to help. And I didn't ask at the beginning, but were there any questions or comments for Laura and the team from the materials they sent out, the dashboard and the outline of what was going on at each of the campuses? Anything jump out at anybody?
No, it was great, Laura.
Okay. Okay, so I think with that, we'll go into a closed session, and Laura is going to tell us how we do that mechanically. And in the closed session, under the Open Meetings Act, we are allowed to discuss personnel matters, training and development for the board, and issues like that. And those will be the types of topics that we will cover tonight. And that is consistent with the Open Meetings Act. So what do you want us to do, Laura?
So we need a motion to go into closed session for the purposes of discussing training and development for the board pursuant to DC Official Code 2-575B12.
So moved.
Second?
Second.
Okay.
Now we need a roll call vote.
Now we need a roll call vote. Okay, Patrick.
Yes.
Okay, Judy.
Yes.
Colette.
Yes.
Mara.
Yeah.
Terry.
Yes.
Jenny.
Yes.
Nicole.
Yes.
Ahmad.
Yes.
Sterling.
Yes.
And Emily.
Yes.
Okay, I think I got everyone. So I think it's unanimous in favor of going into closed session.
Great. And I'm going to let the rest of my team go.
Okay. Thank you, team. We appreciate everything you're doing in these very extraordinary times. Thanks for everything. Hang in there.
And huge thanks to Serge.
Thank you all so much.
Serge
Yes,
this week, and this is his last week. So on behalf of the board, just want to say huge thanks, incredible service to DC Prep, Serge.
Yeah, we'll miss you, Serge. I think you know that, but we all wish you the best.
Thank you, Serge.
Thank you so much, Serge. Really miss you.
Thank you so much.
Good luck.
Thank you. Thank you.
Thank you.
Okay, I'm going to stop this recording.